The St. Margaret's family of facilities has been dedicated to caring for those in need in the greater New Orleans community for almost 130 years. At the St. Margaret's family of facilities, we offer you and your loved ones a higher level of personal attention and compassionate care. Whether in the comfort of his or her own home, at one of our inpatient facilities, or our community residence, we strongly believe that having a sense of hopefulness and purpose is of great importance. We understand that aging can be a difficult process, which is why we offer a nurturing family environment. Our mission is to serve the community with the highest quality of care and enhance the quality of life for your loved one. We are a faith-based, nonprofit agency where care and comfort go hand in hand. Stay tuned, and you will learn why so many families have entrusted their loved ones to St. Margaret's, where quality care and sincere concern come together. Join us as we take some time to share with you the many comforts of the St. Margaret's family of facilities.
Belleville Assisted Living is located in the historic Algiers Point neighborhood, blocks from the river, just a short drive from downtown New Orleans. And we're part of the larger St. Margaret's Daughters organization. We're the newest branch in long-term care here in the city of New Orleans, providing a home environment for the elderly population. Belleville Assisted Living's mission is very much the idea of creating an environment of independence when you want it, assistance when you need it. We strive to provide a home environment for our residents in that everyone has their own private apartment, and we create an environment where the residents have their own lives here on campus and they're a part of this bigger community. We want to assure not only our residents that are trusted in our care, but their family and friends that should someone be here in our community, they're going to be provided for. Should any kind of circumstance arise that they need assistance, we have 24-hour care here available on campus for our residents, a dedicated and hardworking nursing staff and management staff to provide a step above, really, care level for any of our residents here. At Belleville Assisted Living, one of the primary things is taking care of our residents, and that goes from anything from the more medical side of the nursing care that we provide here all the way through just the safety aspect here on this home environment. So we do provide 24-hour staff, so the campus is a secure campus. All of our apartments are equipped with a nurse call system, so every resident has the ability to wear a pendant or a wristwatch to kind of alert any staff member really of any kind of assistance they may need, whether it be a simple request or something bigger situation that may evolve. One of our main parts is the kind of historic value of the facility. We're located in the old Belleville schoolhouse that's been here in the Algiers Point neighborhood for over 100 years. And one of the more unique and really cool experiences of being part of this facility is that we've been able to reconstruct this old schoolhouse and its surrounding campus into a luxury senior living facility. We have 52 fully privatized apartments here. All of our apartments are private bedroom, private bath. All of our apartments come equipped with a full kitchenette as well. All of our apartments are uniquely laid out, so no two apartments on our campus really match. And we have a lot of ranging sizes, so anything from a boutique or a studio style apartment all the way up to a full suite that can accommodate couples or someone who has a lot of furniture or whatever it may be. We really are able to provide as much of the different sizing abilities for our apartments, as well as we're really unique in that we're located on a campus. We're not located in just one institutional style building. We have a 6-building campus, our own outdoor courtyard, a chapel here on campus, activities center. So you really are able to see as much of an home environment spread throughout the entire campus rather than that one institutional, one building feel.
The apartment couldn't be a nicer facility. I think it's the nicest one in here. It's almost like being home. We have the large bedroom and huge bathroom, and it's just very unique. I know everybody, it seems, in the neighborhood here, and they're all good people. They are.
One of our main goals is to enrich the lives of our residents, and whether it be filling their days with general activities, whether it be exercise classes or religious services, memory classes, whatever it may be. We have weekly wine and cheese events for our residents, birthday parties, On campus and off campus social activities. We provide our own transportation. We have our own Belleville bus here that takes our residents to doctor's visits, casino trips, shopping trips, to really be able to provide all of those amenities you may have at home here on our campus. So at Belleville Assisted Living, dining is our number one. Our executive chef and his dietary staff work each and every day to provide one of the most unique and gourmet dining experiences for our residents. We don't have a cafeteria, we have a dining room. All of our residents are served by our staff here on campus. You don't serve yourself. You get a daily menu under your door every day to pick what you like. We really take into account our dietary preference to be able to really make that dining experience as interactive and pleasurable as possible for all of our staff. And the food's great too. So, one of our big things is the resident themselves, and that is the most important for us for them to be comfortable in their environment. So because of that, we don't restrict our campus by any means to any outside providers, in the sense of if someone has their own home health services, they're able to bring those home health services here onto their campus. If you have a sitter service, you're able to bring those sitters here, and we're welcome that as part of our community. We really are able to foster that environment of the resident first above anything else here on campus, and we want them to be comfortable as part of our new family. In addition, one of the benefits of being kind of part of this larger network of organizations with St. Margaret's and St. Luke's, and being that St. Margaret's Daughters family, any resident that joins our family here as a Belleville resident is guaranteed long-term a spot in either one of our facilities should their care kind of exceed the level we're able to provide here. So any resident that joins Belleville will ultimately have the opportunity to become part of the St. Margaret's Daughters nursing home or the St. Luke's nursing home should that need arise. To become part of the Belleville Assisted Living community, it's very, very simple. Obviously, we're happy to give tours of our facility to any prospective resident or their family members pretty much any day, any time. We're able to cater our services around the availability of the prospective resident and their family. We are online as well, bellevilleno.org. Belleville Assisted Living is truly where comfort and care come together. It's more than a beautiful home, it's a true community.
My children thought that it was the best thing for me to go on, go to assisted living. Though, like I said, we had to look at others, and this one is so much like home, just like at home. It's assisted living, but you can do whatever you can do. And in fact, they found this place for me, and they really had a hard time to get me to move from my home. But they told me they really were about me living alone. And after they showed me this place, that was it.
St. Margaret's was founded by a group of Catholic laywomen in 1889. They recognized they wanted to do good works in the community and that widows needed a place to live. So St. Margaret's became a nursing home in 1931, and their mission is to serve the poor, frail, elderly. The first nursing home was in the lower 9th Ward. After Katrina, they were not able to return there, so we have been able to build this new facility that we are now living in. St. Margaret's mission is to serve the poor, frail, elderly with compassion and love and make it to be a home. We have people here who are long-term residents that live here for the duration of their lives, and we also have people who come in for short-term stays to get rehab and then go home. St. Margaret's is unique in that we are living in households now. So we have neighborhoods of residents where we have about 18 to 20 residents, and they are taken care of by a household coordinator. They have a nurse in there, and then they have aides as well. There's also a homemaker that cooks their food and helps clean in that neighborhood.
Our physical building is more home-like than most of the other institutional type nursing homes in the area. And we didn't just change everything about the walls and the physical structure. We are changing the operation and trying to change the nursing homes that the way they've been run for the last 40 years. It's fine to, when you're in the hospital, to live like that for a few days, but to live that way the rest of your life, it's just not the way it should be.
It's not a nursing home where there's long hallways and you go to the main dining room to eat. Each household has a dining room, a living room, a full-service kitchen, and then private rooms encircling living areas. So they have plenty of space to make it their own home.
For me, it is perfect because it gives you a chance to be independent and to do some of the things for yourself.
The nurses that work at St. Margaret's are very self-directed. They know the residents very well. They become the residents' family members. They know the medical needs of the residents. They communicate with me on a daily basis. They communicate with the physicians, and of course they also communicate with the families.
St. Margaret's staff is taking care of the residents from the time they wake up to the time they go to bed and even as they sleep. We have people who are cooking and cleaning in the household for them. We have people who are taking care of them, giving them their personal needs. We have therapists that come in and out, and we have the nursing care to meet their needs and help pass their medications.
We have two doctors that are on staff. We have residents that come once a week. They are on 24-hour communication with the nurses regarding the residents' needs. And they are in the building at least once a week, but 24-hour communication.
We have a wonderful giant chapel that the residents are able to have all their religious services in. We have 2 courtyards where they spend the time enjoying the sun and the warmth. We've got a multi-purpose room where they can do the large group activities. And then we also have a piano that they like to gather around and listen to the musicians that still come out to sing. And then we also will have on the first floor a household that is the Team Gleason model. This household will serve ALS residents with technology that allows them to be as independent as possible and help them to continue to live. So the Team Gleason household has the technology in place to be able to have people with ALS continue to do what they know how to do as long as possible, no matter how far their disease process takes them, but for them to be independent as much as possible.
Old St. Margaret was the best that I had been in. Now this is better than the old St. Margaret. And you couldn't ask for anything more.
St. Margaret's vision is to change the way that nursing homes are perceived, not only conceptually, but also to just turn it around 360. It's not a place that people come to just be. It's a place that people come to live and continue living.
They're enjoying that they can be a part of the life of the household. Residents are so excited about being able to smell the brownies as they're baking, to wake up in the morning and say, I would like a hard-boiled egg and grits, and have it served right there for them. Residents are really enjoying the ability to have it be like a home versus just living in a dormitory or living in a hospital type setting. We want St. Margaret's to be a place where families, residents, their friends feel comfortable just coming in and out of, seeing it as a home that they're coming to spend time at versus just coming in to see and visit their family member. St. Margaret's loves to show off our new building. Our residents take so much pride in it, and we would love for people who want to come and see St. Margaret's and see what a fantastic nursing home this is to come and take a tour.
When I hit the front door, it seemed that I could feel the love that the people had. And I just knew I wasn't going to leave St. Margaret.
St. Luke's is definitely like a family. It is an important decision and you want the best for your loved one. So it's important to have as much of a home-like environment as possible. And so St. Luke's does offer that. We offer all different levels of care, whether families are coming for short-term or long-term. They can get a variety of levels of therapy, as well as participating in any of the activities that we offer, such as, bingo and book club and all of the Keno and all kinds of stuff like that.
Right now we offer speech therapy, physical therapy, and occupational therapy through our therapy department, which is ran by Triton. We do short-term rehabilitative services, so you can come here for a short-term stay and get rehabilitated and go back into the community. We also do long-term for some of our long-term residents that need those therapy services. And then we have what's called restorative services. I interact every day with the residents, make rounds every morning, do a lot of activities with the residents. I go into the activities. I'm over all the clinical services for the residents, so discuss a lot of their cares and medications. Also troubleshoot any issues they may have with either staff medications or anything like that.
I'm here for therapy, and I have gotten beautiful treatment here amongst the employees. I find it's a beautiful place to be, and everybody is wonderful here. And I'm encouraging anybody to have a problem, need therapy or whatever. It's a nice place to come to. Lovely people know how to treat you.
St. Luke's is very committed to having a lot of family involvement, and it is very much encouraged. So we'll have a lot of different activities, whether it be a Mother's Day tea, to family council meetings, to just people coming for Mass. We do care plan meetings at St. Luke's to help keep the families involved as to what's going on with their loved one, and keep them abreast of whatever their needs may be, and that kind of gives them an opportunity to relate any praises or concerns so that we can help address those.
The residents here are very vocal and very involved in their needs. They can go to anyone and express what it is they want, what it is they need, and it is followed up immediately with myself and the staff. All medication needs, if they want something or feel they need something, they can contact the staff. We follow up, we let the doctor know, we take his recommendations and we follow through. We call the family, let the family know that their loved one is requesting these things. So the resident is very involved in what goes on with them clinically. We have care plan meetings quarterly, which is every 3 months, and at that time, if they want something changed or done, we invite the family, we invite the resident, and we sit down and go over any concerns, complaints, or anything, and we address everything. So they're very involved in the day-to-day, what goes on with them and how it's done with them. We're really involved into culture change. You can go to bed when you want, you can eat when you want, We try to diversify meals and things of that nature. So we're very involved in what goes on with the resident. The resident's very involved in what goes on with them. We incorporate them fully. Well, we have doctors that visit. We have Dr. Myers and Dr. Rose, both that visit here at the facility. And as far as the pharmacist is concerned, we have a pharmacy consultant that comes once a month, Dr. William Day, and he's very involved in what goes on with the medications and how they go. The doctors prescribe the medications, and we just follow them through. We have 24-hour contact with the doctors by telephone or by fax. They respond very quickly about medications, issues, problems, and the staff here follows up really well.
At St. Luke's, the financial aid process can range anywhere from private pay, or it can go to applying their loved ones for Medicaid. And if they do decide to apply for Medicaid, I can help out with the process with filling out any forms, getting them in contact with the appropriate people, and then just following through until we can get those people approved. At St. Luke's, residents either move in coming from home or from the hospital. Either way, personal effects are strongly encouraged to be brought to also create a more home-like environment.
So sometimes people will bring things like refrigerators, TVs, pictures, comforters, pillows, you know, whatever to make them feel more comfortable. The families are very strongly encouraged to bring those.
She found it. You know, she's discovered St. Luke's, and of course I wouldn't give in until I had to see for myself. And I did. They gave me a round, and I loved it. I really did. I liked it. I felt like a friendship.
At St. Luke's, I think the residents have a really great quality of life. There are a lot of activities that they can be involved in. And again, they can get involved whether they're short-term or long-term. So I think it's really good.
Quality of life here at St. Luke's is great. I mean, you have so much input into what goes into your day. It is not a regimented day. Residents get to do what it is they like to do, when they like to do it, with some restrictions, but for the most part, it's like a home-like environment. So they get to participate in so many different things, and it is based upon what they like. We do things that they like to do, they eat the things they like to eat. They participate in what they want and what they don't want. They have a lot of say-so in what their meals are, when the meals are served. And so the quality of life is so home-like here. It's like a home atmosphere with just a larger family. So we like it here at St. Luke's, and our residents love it here.
And I do love St. Luke's. If I didn't, I wouldn't be here. I'd walk. My time is very important. I mean, I'm 88, almost 78 years old, and I don't want that 78 to be wasted.
St. Margaret's Home Health and Hospice provides excellent care to families in the privacy and the comfort of their home. The St. Margaret's Home Health and Hospice team is made up of skilled nurses, certified nursing assistants, therapists, including physical therapists, occupational therapists, and speech therapists, medical social workers, chaplains, volunteers, and bereavement coordinators. Our Home Health and Hospice administrative offices are currently located at 3525 Bienville Street. It's a brand new facility on the site of the old Mercy Hospital in Mid-City, New Orleans. A very beautiful facility, very happy and very proud of our new facility. The St. Margaret's Home Health and Hospice team supports the family from the very beginning of the process. From the initiation of the referral, we assist them with setting up the care, with verifying their coverage, with linking with their insurance companies and getting the ball rolling. We assign the specific disciplines. We answer all of their questions. We help them to become at ease with whatever the process is that they're going through at the time.
On the home health side, we have, if we have a patient, depending on what the need is, we go in, and if the patient has hypertension, we go in, we teach them about the disease process, about the complications that go along with that disease, the signs and symptoms of those complications to report to the physician or to me, or the things that they need to know to call 911 if they see certain blood pressures or blood sugars. We teach them about the importance of their diet. That's a big issue, and the importance of taking their medications on a daily basis at the right time as prescribed.
Recognizing that the dying process is very difficult for families and patients to accept. The St. Margaret's team assesses where the families and patients are from the very beginning. We meet them where they are and try to meet their needs. From that point forward, we do provide spiritual support through the process, whatever stage of grief they're dealing with. We also provide bereavement services, chaplain support, medical social worker, whatever the patient needs in their families are. It's a family-centered approach to care, so whatever their needs are, we meet them. St. Margaret's Home Health and Hospice team often assists families in deciding what the appropriate setting for health care is. And in most cases, that is institution or facility inpatient care versus care received in the home. And very often, the same services are available in the home, and it's actually a better option in a lot of cases for the patient. For example, it's private. It's in the privacy of your own home. It's personal. It's generally one-on-one. You have the opportunity to be surrounded by your family and friends. So it's very comforting to have skilled services in your home.
In hospice, quite often, most of the family members, they don't have any medical experience. There's quite often some discord in the family. Some people feel as though you're giving up on mom, you're giving up on dad. And what I try to teach people is that just as there's a way to come into this world, i.e. pregnancy and the baby starts to breathe, that is in those whole 9 yards with the pregnancy, there is a process that the body goes through when you are dying. And so I explain to them what they're seeing. I explain to them what may happen next. I'm there whenever they need me. As we get close, I may be there every day. I am really at that point probably there more for the family than I am for the patient, because the patient has begun to transition and the patient is comfortable with that, and quite often they're ready for that. It's the family that's having a hard time saying bye.
Whatever the patient needs, whenever, we are able to provide that 24 hours, 7 days a week, including weekends and holidays. We pride ourselves in building relationships with our patients and their families. And long after the patients are out of our care or have gotten either better on the home care side and transitioned to independence, or on the hospice side have transitioned after death, we maintain those relationships.
The thing I love the most is that we all seem to be on the same page. We all care about our patients. We communicate with each other. This organization is just fantastic because they support me while I'm in the field. If I need anything, I call into the office. The ladies in the office are wonderful. They take care of those things. Everybody cares about the patients, and I just absolutely love it.